Hello everyone, and the topic of today's session is clinical radiology. Clinical radiology. It is a type of medical specialty which deals in imaging technologies which are then used for both diagnosis and treatment of patients. Here is a collection of various films that you will deal in your daily practice, from skull to feet to hands, wrists, abdomen, chest. Imaging technologies are used all over the body. Okay. Now, the conventional radiology. This is a typical setup for conventional radiology. The first one is the X-ray source. The X-ray source produces X-ray in a projector-like fashion, like the letter V. Then we have detectors. These detectors then detect the X-rays that are either absorbed or transmitted through the body. As you can notice here, there are two types of detectors here. One for the patients who are lying down and one for the patients who are standing up. Now, conventional radiology works on the principle of attenuation. Attenuation means the differential dispersal of X-ray when it hits our body. Because our body, each and every tissue responds differently. Either the X-rays get absorbed or they get transmitted through our body, or through some tissues some degree of absorption or transmittance happen. Now this attenuation produces grayscale upon the film, from the dark black, then the shades of gray to complete white. These coloring scheme is what we call radiographic densities. What are radiographic densities? There are four natural radiographic densities. That is the bone, which usually absorbs all of the X-rays. That's why it's usually white. Then we have fat and soft tissue, which somewhat absorbs the X-rays and a little bit is transmitted. So we get a shade of gray. Now that shade of gray depends on how much is absorbed and how much is transmitted. Then there's the air. Air does not absorb the X-rays. So if there's air present, it would give you a black coloration on the film. Okay. Next, our topic is there is a fifth type of observable densities. Now, these densities are not natural. They are not usually present in our body, like calcium deposits. Now, calcium deposits completely absorb the X-ray or they're radio opaque. That's why they're shown white, but they're not natural. Or in this film, there's a metal coin in the nose of a child. Now, that coin completely absorbs the X-ray. So we have total of 5 observable densities. 4 are natural, 1 is not usually found, and when it is found, it is usually in the unusual situations. Next, we have a pH chest radiograph. Now, there's a common saying that the eyes cannot see what the mind does not know. To the untrained eye, it might just be a collection of black and gray and white. But to the trained eye, it tells a lot more of the story. Now, these gray tones are the radiographic densities. Now, I was talking about the trained eye. Radiology requires a lot of practice, and through practice is how you can achieve excellence. Here's an example. Now, again, it might look like that it's just a simple chest x-ray with one lung, a bit of a heart, but it's not like that. Here, can you see that the stacking and some gray border between them, that represents the spine. Next is that tubular structure that goes from top to bottom. That is your spine and aorta. Any problem with the aorta or the spine might manifest here. Then there's a point in the disc space. As I earlier said, that the spine is shown like stacking. So the point of disc space, that is the area between the vertebrae, you can also measure. If it is extended, it can be observed. If it is less, even that can be observed. Next is the left border of the spine and aorta. Like I said, any abnormality in the aorta or spine can be observed. It might not be pronounced, but it can be. Here is the left border of the aorta. So I think you can appreciate that tubular narrow way that goes from the top to the bottom. Here is the right border of the spine. Now, this structure is the heart, but the heart does not go all the way down. It has a pad, which I'll show you later. Okay, now to the extreme right, you can appreciate the intramuscular fat plane, the subcutaneous fat. So if there's any change in that, you can even observe that. Next is the epicardia fat pad. So the heart does not extend all the way down. That gray point is actually the fat pad or the visceral fat that surrounds the heart. And this other area is the lung. You can even appreciate the intercostal, the rib cage. Some of it is even visible here. This one is the muscle, a little bit outside the fat pad. This one is the ear. Now this ear is found in the stomach, and it is usually a point that we usually see first. So you can see that with training, with knowledge, a simple radiograph has turned into so much complex, but it shouldn't be difficult. With our further lectures, and this lecture will teach you how to deal with it, how to study it, and how to become so much trained that it will be like the easiest thing you have ever done. Radiology is not difficult, it just requires practice. Now, in radiology, there's often talk of resolution. There's three types of resolution. One is the temporal resolution. Temporal resolution deals with the time, that a certain time has passed between two films and those two films are joined together and presented. Now, this type of resolution is used in cases where there's something that is developing, like there's some kind of hemorrhaging or fluid leakage. So this resolution comes handy during those kind of situations. Next one is the spatial resolution. Now, spatial resolution can be is can be described as how far or how less you can differentiate between 2 points in space. The less they are, the more clearer the picture is, or simply how clear or how sharp the picture is. That kind of a resolution is called spatial resolution. Next one is the contrast resolution. Now, contrast resolution is used when we introduced a certain contrast media. Now, this contrast media helps us differentiate between the tissues which are not usually differentiated easily, because this contrast applies to only one type of tissue. So the distinction between two becomes easier. Next is the PA and the AP chest radiography. Now, here is a chest radiograph. This is the PA view. Next one is the chest radiograph but AP view. Now, immediately you can notice two things. First one has the breast shadow. The second one lacks the breast shadow. The first one, the heart is smaller, but in the second one, heart is larger. Now, these both radiographs are from the same person. This does not mean that the heart has swollen or there's some kind of cardiomyopathy or hypertrophy. No, it's just a matter of projection. What are these projections? We'll study here. Now, first off, the PA projection. Here. Now, in PA projection or posterior to anterior projection, the X-ray source is behind the patient and the detector is in the front. That's why in PA projection, heart appears smaller. See? Okay. Next is the AP projection or the anterior posterior projection. Now, in this one, the patient is actually facing towards the X-ray source, and the X-ray detector is at the back, and this is how it will appear. So, it's just a matter of projection. Usually in chest radiography, we prefer PA projection. Why? Because first of all, we have more area to observe the lungs. Second, it is more convenient in patients. Okay. Next are the lateral views. Okay. This is a left lateral radiograph of the lumbar spine. Now, I would remind you that it's written left. In every lateral view or lateral projection, this always be given that it's either the left side or the right side. And it is very important because our body differentiates a little from the right to the left side. So if it's right or left will give you a better idea and a better understanding or how to read your radiograph. Now comes the oblique views. Oblique views are the one where patient is tilted. Here one example is given, the Grashey's view, which is for the glenohumeral joint or the shoulder joint. But in order to evaluate the shoulder joint, it is not either the AP or the PA view. We use the Grashey's one, which is tilted a bit. Why? This will explain it a little better. Here, if it was either an AP or PA view, the joint will be superimposed upon each other. We do not want that. We want a clear picture of both the humerus, the clinoid fossa, the acromion, and the rest. So, oblique views are usually used in joints to get a better picture of how they are and how to read them. There's another oblique projection, the right posterior oblique projection, which is shown from right to left. Next is the left anterior oblique projection. Now, there is a rule in radiology that the radiograph is always printed like the patient is standing in front of you. And this is the rule that is always followed, either in the AP, PA, or the lateral views. The only exception are the hands, wrist, and the feet. Now, why is that? Here. Now, the left anterior and the right posterior both produce the same radiograph. Both are presented right to left. So even in oblique position, the radiograph will be presented right to left. This example here is to illustrate the point that radiographs are always printed like the patient is standing in front of you, except a few exceptions like the hand, wrist, and the feet. They are printed like you're watching your own hand or your own wrist or your own feet. Okay. Next, in radiographic projections, here's a comparison of a sagittal MRI and a CT scan. We'll study them in detail later on, but here you can appreciate the difference between an MRI, that's the first image, and the CT scan. In the MRI, few structures are more clearly visible. In CT scan, it's not. I'm talking about the brain here. But in the CT scan, the bony part are more clearly visible, but in MRI, they are not. So, both the MRI and CT scan have their advantages and their disadvantages. Mammography. Now, mammography is a subset of conventional radiography. In mammography, we use low dose X-ray for early detection of breast cancer. Now, mammography is more used as a screening test than a diagnostic test. The diagnostic tests are usually FNAC or histology. It is actually used for screening because breast cancer is one of the leading causes of death in female, and it can be avoided. Breast cancer can be avoided if it is detected early. So mammography can be done as a screening test. It can be done en masse. It can be done rapidly and to all a patient. And it is actually recommended to be done to every adult female. Now, here is an example. You can see here that there's a little lump. This little lump here on your mammogram, now this can be an harmful lipoma or a harmful cluster of tissue, or it can be a malignant tumor. We do not know that until we perform further tests, but this patient will get marked for further studies. But if the mammogram is not done, this patient If she has cancer, it will progress to the next stages. So, mammogram as a screening test is also an early warning and early detection system. Another thing about mammogram is that it's done in a craniocaudal position, or simply from top to bottom. It is presented like you're looking from top to bottom, with the right breast on the right side and the left breast on the left side. Here is an example. Okay, next is the fluoroscopy. Now, as the name suggests, it uses fluorescent dyes, or sometimes even the fluorescent dyes. One of the examples can be the barium meal or the barium enema. In fluoroscopy, these fluorescent dyes actually give more radio opacity to the film and give a clear contrast. Now here there is a barium meal and the barium is moving through the gut. Now as it moves through the gut, a series of radiographs are taken, and each radiograph tells us if there's any problem with the gut, if there's any stricture, any kind of puncture, anything. So fluoroscopic radiographs, they're usually done in series. They give you a better contrast resolution and they are easy to process. In case of barium meal, all you have to do is to provide the patient with a barium. The patient has to swallow, and then you take a series of radiographs. Okay, next. Next modality is the CT scan or the computed tomography. Now, here is example of a typical CT scan machine. Now, if you compare it to the earlier one, the conventional one, you will notice that it's kind of the same, but it's more advanced. Because here they have the same principle, the attenuation that we discussed earlier, but instead of a single source and a single detector, we have multiple sources and multiple detectors, and all these detectors and sources move about in a circular fashion like this. Now, when they move about in a circular fashion, attenuation in our body occurs at millions of places. The X-ray is absorbed, transmitted, it is dispersed at a lot of angles, and all of those X-rays are captured and then composed into an image. And that image is what we called a CT scan image. That image usually gives us more knowledge, more information about the body, depending upon which kind of a slice it is, or the plane. We'll study that in a bit. Here's an example. Now, this is an exo CT of the abdomen. You can view the spleen, the liver, the kidneys, your vertebral column. And here is the coronal CT of the chest. You will notice that the first image is a horizontal slice and the second image is a vertical slice of our body. Both can be done in the same study. It just depends upon the doctor and the radiologist who decide upon which is best for the patient. Now, what is this sagittal and coronal and axial? All of these are anatomical planes. Now, these anatomical planes, one of the most common is the coronal plane. In the coronal plane, the body is divided into an anterior portion and a posterior portion, like the one we did in the conventional radiograph, the AP and PA radiograph. The second is the sagittal plane. The sagittal plane divides the body into a right section and a left section. Next, we have the oblique plane. Now, this oblique plane is actually a slice, a horizontal slice of the body, but at an angle. Why at angle? We'll study that in our next few slides. But the oblique plane, just for the reference, is just like a transverse on axial plane, but with an angle. Now, why these planes are required? Now, here is an example. Now, this is a patient, and that blue is a structure. Now, if you view it at this slice, you only see it a tubular structure. If you like, it's a slice. If the axial slice is another side, it will be like there are two structures, but actually they're two parts of the same one. In the next one, it will look like it's just a small tube. So, CT scans must always be studied in a series. They must never be done in a single slice. They must always be studied in a series, from top to bottom, from front to back, the way they are produced. A single slice will give you a false idea, just like it's shown here. That's why we specify the planes and the positioning of those planes during the CT scan. And again, it's up to radiologist to determine according to the symptomology. Okay. Next one is the imaging. There's another way of doing CT scan. The first one is the maximum imaging projection. The second one is the minimum imaging projection of the same chest CT. In the first one, you can see all kinds of structure, but on the second one, only the lungs are visible. Now, which kind of projection you want? This is the choice that the physician has to make and has to be conveyed to the radiologist, because it's all about making the correct choice, which modality you want to use, and in that modality, which kind of slice or plane you want to use, because it's your choice that's gonna give the proper diagnosis or the proper treatment to the patient, and that is our ultimate goal. Okay, next one is a recent one, a 3D volume rendered display. As I said, the CT scan contains multiple sources of X-rays and detectors. Nowadays, we have super fast computers which can render that information into a 3D model. And that 3D model gives us a better idea, even of the finer details. Like here, there's a fracture of calcaneum. Now, that fracture of calcaneum can be better appreciated if it's volume rendered. If it was a normal CT scan, it might not have been that much observable. Another goal of this 3D CT scan is that it is more easier to show to the patients. The patients are more inclined or are counseled better when they're shown their CT scan in a 3D way. Next one is the magnetic resonance imaging or the MRI scanner. Now, this is a typical MRI scan. The first thing you'll notice that it's huge. Second one is the patient has to lie inside that cylinder, not outside. The whole body of the patient must lie inside this cylinder. So for those patients who are claustrophobic or those who are scared of narrow spaces, MRI is not the choice for them. Now, MRI works on the principle of magnetic resonance. What is magnetic resonance? Well, MRI scanner contains a huge magnet, and that magnet is usually differentiated based upon its power. Usually 1.5 Tesla magnets are used. Now, this magnet resonates with the protons in our body, the protons in the water in our body. Now, this resonance with the magnet in the MRI produces radio waves, and these radio waves are then captured by the MRI machine. Now, these radio waves are not X-ray waves, so they are non-ionizing and they're hardly harmful to the body. So it's considered more safe than the CT scan, but it's more expensive and it takes a lot of time to generate the image. Another thing is that apart from the main magnet, there are also multiple other magnets that are distributed along the cylindrical body, which produce the gradient, and that gradient produces the contrast or the finer details in the imaging that is produced. Okay. Now, in MRI scan, each tissue type responds differently to the magnetic resonance. It's not like the CT scan or the conventional radiography where just depends upon the absorption or the transmittance of the X-rays. Every tissue type responds differently. So in T1 weighted imaging and there's T2 weighted imaging. The fluid in T1 weighted appears dark. In 2 it appears bright. Then we have air. It appears black in both. We have the muscle. It appears intermediate to dark in both. The same case is with the tendon and then the bone cortex, which appears black, or in T2 weighted again black. So you can appreciate the basic difference in T1 and T2 weighted imaging, that's type of MRI, is the fluid or the water. I illustrate that in the next here. As you can see, the CSF, the first one is a T1 weighted MRI image. The second one is a T2 weighted. In the second one, there is a water hyperintensity. The water in the CSF appears bright, but in the first one, it is appearing black. Otherwise, there is not much of difference between the both images. But there is much complexity among MRI. There's a lot more modalities of MRI, and this is what we call the windowing and leveling. CT scan can produce about 16 different types of different shades of gray, or its gray scale is just limited to number 16. But MRI has a lot more variety. It can produce grays in more quantity, up to hundreds, depending upon the type of the modality or the type of the MRI that is used. Here is an example. We have 3 MRI of the same patient, but in the first one is we're using the soft tissue windowing. As in this one, you can appreciate the intercostal muscles and the fat between them, because we're using the soft tissue windowing. We're using only those type of grayscale that corresponds to the soft tissue. In the second one, we are using a lung window. In the lung window, only those grayscale are selected which corresponds to the lung. So in the second image, the lungs and the pulmonary veins are a lot more visible. The third one is the bone window. In the third one, bones are a lot more clearer. You will notice that the intercostal bones are the costal bones. You can see both the cortex and the medulla. So in MRI, instead of using all the shades of the gray, you can actually choose which shades of the gray to choose. This selection in MRI is called windowing, and this windowing can result in vastly different films in the same patient. Now, the decision to use which kind of windowing or leveling to use rests upon the physician, the radiologist, the disease of the patient or the symptomology. But as illustrated here, MRI is much more versatile, and you can do multiple studies in the same window. In the same session, you can do multiple studies. Next, a few examples. Okay. The MRI is not only limited to T1 or T2 weighted imaging. It can be proton dense, the coronal proton dense fast spin echo. It can be fast spin fat suppressed. It can be T2 weighted fat suppressed sagittal proton density fast spin echo. All of these produces different kind of imaging. Now, what is this proton density? Proton density is where neither you use the T1 weighted or T2 weighted imaging. You use a neutral type that is called proton dense image. The fast spin echo is just a type to say that if the proton produces more radio waves or less radio waves, which are captured by the MRI machine. So decision to use these is again of the radiologist. Next one is the ultrasound or the ultrasonography. Now, ultrasound works on the principle of sound waves. It does not rely on radiation, either ionizing or non-ionizing. It works on the principle of ultrasonic sound waves. Now, here is a picture. We are using the ultrasound gel, and this is the ultrasound transducer. The ultrasound transducer contains a special type of crystal, the piezoelectric crystal, which converts the electrical signal into mechanical ones or produces shock waves in the ultrasonic spectrum. Now, these shock waves travel through the body and then they're reflected back. Now, how they are reflected back is what is called echogenicity. Each and every type of the tissue in our body has different type of echogenicity. So this echogenicity or the echo which is produced by the ultrasonic sound waves in our body is recorded by the transducers, and that is converted into an image. The second property that the ultrasound uses is the Doppler effect. Now, the Doppler effect is that when a sound is thrown at a target, it reflects back and there's a shift in its wavelength. That shift in the wavelength and frequency tells us about its velocity. Now, this property, the Doppler effect, is used by ultrasound to measure the blood flow, both its velocity and volume. Now, I said the ultrasound works on the working principle of echogenicity, that the echo of ultrasonic sound waves in our body. Now, this echogenicity can be described in a variety of ways. First one is the acoustic enhancement. That is the first one from the left. Now, this circular area contains water. Now, we know that sound travels best in fluid medium. So, anything that is behind a fluid medium gets a better visibility or gets an enhancement in resolution. This is called acoustic enhancement. Next one is the acoustic shadowing. Sound travels slowest or sometimes completely retarded in air-filled cavities. Now, in this cavity, the tissue behind the cavity is completely obscured because it does not contain water, it contains air, and that air is retarding the ultrasonic waves from echoing. So the tissue behind it cannot be visualized. Next one is the hyperechoic area. Now, this cavity is hyperechoic because it contains both the solid matter and large amount of water. It is not filled with water but contains a rather large amount of water. So it will produce more echo. Next one is the isoechoic. Now, in isoechoic tissue structures, both the hyper and hypoechogenicity is happening. One of the example is the kidney. Kidney has the cortex and the medulla. The medulla is hyperechoic and the cortex is hypo. Next one is the hypoechoic. Now that cavity that is on the far right is hardly visible because it is not producing any echo, and that echo is not being read. So it hardly registers on the screen and hardly is read. Now here is an example of a typical ultrasound. This ultrasound image is of a fetus in the mother's womb. You can appreciate the fluid-filled cavity, the amniotic fluid in which the fetus rests. And you can appreciate that it is surrounded by a layer. That layer is the uterus. So, again, ultrasound works best for water-filled areas, such as during pregnancy, pleural effusion, joint synovial joint studies. So water containing structures are the ideal for the modality of ultrasound to be used. Okay, here is a sagittal ultrasound. Now on the abdomen, in the far right corner, you might see where the transducer is placed. Here you can see both the liver, and in the liver portion, you can appreciate both the hepatic artery, the hepatic vein, and the bile duct, the hepatic triad. You can also notice the right kidney, both with its cortex and medulla, and the superior diaphragm that is beneath it, because the transducer is always placed at an angle. Here it is produced at an angle like this. So we have like this. So we have an image of liver, then the kidney, then the superior diaphragm at the back. Next one is the nuclear medicine. Now, nuclear medicine uses a specialized kind of a scanner called PET scan or positron emission tomography. Now, nuclear medicine uses specialized material called radionuclides. These radionuclides produce radiation from within the body, and that radiation that is produced within the body is read by the scanner, like in a PET scan. So, nuclear medicine is radiology from within. Here is an example of a radionuclide bone scan. Here, a radioactive isotope was labeled to to a compound, and that compound was then metabolized. A usual example is fluorine. Fluorine 16 with glucose is usually used, and the way that labeled glucose is metabolized in our body produces the image that where the glucose metabolism is more and where it is less. It might even produce areas where it shouldn't happen, but it is happening, and it might help us locate unusual anatomical positions or cancer, because cancer are hypermetabolic structures. So nuclear medicine is used to detect cancers or to study bone, how the metabolism of bone is working in this instant. Now here is a typical PET scan. As you can see in the PET scan, we use a common compound, label it with a radioactive isotope, which is called the radionuclide, and then we introduce it in the body. Now, that compound then travels the body, and where that compound is metabolized or accumulated, that areas are highlighted on this picture. This is a PET scan of the fluorine labeled glucose. Thank you so much for watching sqadia.com.